और मेरा संगीत.com के आज के चैट इन चाय की पॉडकास्ट पर आपके रूबरू रहेंगे जाने माने यूनाइटेड स्टेट्स के प्रैक्टिसिंग डॉक्टर विकास भतारा। आज हम उनसे बहुत सारी जानकारी लेने वाले हैं अबाउट
Kamal, today we'll talk about COPD. It's a lung disease called chronic obstructive pulmonary disease.
COPD क्या है ये हम जानते चलते हैं डॉक्टर भतारा से।
COPD is a lung disease that makes it hard to breathe. In people with COPD, the airways, that is the branching tubes that carry the air within the lung tissue, become narrow and can be clogged with mucus. The air sacs can also become damaged, which makes people to feel out of breath and tired. COPD can be a serious illness. It cannot be cured. So I want to emphasize to our listeners that COPD cannot be cured and can get worse over time. But there are treatments that can help. You might have heard the COPD is called chronic bronchitis or emphysema. So I always tell my patients that COPD comes in two flavors. One is called chronic bronchitis and the second is called emphysema. So if somebody tells you have chronic bronchitis or you have emphysema, that means you have a COPD as a basic surname, and then chronic bronchitis or emphysema is a subtype of COPD.
So Dr. Bhatara, my next question here is what causes COPD?
The most common cause of COPD is smoking. Smoke can damage the lungs forever and cause COPD. People can also get COPD from breathing in toxic fumes or gases. And in rare cases, COPD is caused by genetic problems. A blood test can check for this.
All right, Dr. Bhatara. And what are the symptoms of COPD?
At first, COPD often causes no symptoms. As it gets worse, it can make you feel short of breath, especially when you're moving around, make you wheeze, make the whistling or squeaking noises as you breathe, make you cough and spit up sputum, that is mucus. People who have COPD are also at risk for infections such as pneumonia, lung cancers, and heart problems.
So, Dr. Bhatara, is there any kind of a test for COPD?
Yes, your doctor can give you a test called spirometry to check the COPD, but then you will need a full pulmonary function test to know which type of COPD you are having. During spirometry, you take a deep breath and then blow out as fast as hard as you can into a tube. A machine connected to the tube measures how much air you can blow out in your lungs and how fast you can blow out. If the results of your spirometries are not normal, you will get a medicine in an inhaler to see if your breathing gets better. Then after a few minutes, you will repeat the spirometry. This will help the doctor to find out if the problem is caused by COPD or another lung problem such as asthma. People with asthma usually get normal results after they use the inhalers. People with COPD often do not.
All right. So is there any other test that would be required other than spirometry?
Your doctor might order some other tests too. These can check to see if other problem besides COPD might be causing your symptoms. They can also look for some of the problems that COPD can lead to. That test might include a blood test. This can check for a genetic problem called antitrypsin deficiency that can cause early COPD in people who smoke. Chest X-ray can be done. ECG, electrocardiogram to measure the electrical activity of your heart, and a low-dose CT scan. This is an imaging test used to screen the lung cancer, but it has to be age appropriate.
So, Dr. Bhatara, another question here that I have in mind is about the treatment of COPD. How is it treated?
How is COPD treated? There are four main types of treatments for COPD. Medicines. There are a lot of medicines to treat COPD. Most people use inhalers and can help open up the airways and decrease swelling in the airways. And often people need more than one inhaler at a time. You might need to take steroid medication in a pill for the COPD flare-ups. A flare is when the symptoms suddenly but temporarily get worse. Oxygen. If the disease gets worse, you might need to use oxygen. Your doctor can test your blood oxygen level to see if you need it or not. Pulmonary rehab. In pulmonary rehab, you learn to improve your symptoms in new ways. You learn exercises and ways to breathe that can help ease symptoms. Even if you don't do a pulmonary rehab program, staying active can help your breathing. Surgery and endobronchial valves. Rarely people with emphysema type of severe COPD will need surgery, and surgery removes the most damage damaged part of the lung, the surgery can reduce symptoms, but it does not always work. Also, rarely doctor can place small endobronchial valves to damage the airways. This can help shrink abnormal area of the lungs and help the healthier part of the lungs to work better. The valves are placed using a thin tube that goes down your throat called bronchoscopy.
So, Dr. Bhatara, is there anything that the patients can do on their own?
Yes, you can take care of yourself by avoid smoking, avoid triggers, lower your risk of infection, make healthy lifestyle changes. Quit smoking is the most important things you can do for your health. This is true no matter how long you have smoked and how much you have smoked. If you're having trouble quitting, your doctor can help. Avoiding triggers like fumes, pollution, dust make your breathing worse. Try to avoid them. Lowering your risk of infection. Certain infection can be very hard on your lungs, can cause COPD symptoms to flare up. So you can lower your risk by getting certain vaccines. These include vaccine to protect against the flu, pneumonia, or COVID. In addition, wash your hands often and stay away from the people who are sick. Make healthy lifestyle changes. Eating a healthy diet can improve your health. You can also improve your health by following your pulmonary rehab program if you are in one, and finding other ways to move your body.
Thank you so much, Dr. Bhatara, for all the detailed information there on COPD. So, अगर आपको फ्रेंड्स कोई भी जानकारी लेनी है COPD के बारे में, kanwal@merasangeet.com पर आप पहुंच सकते हैं. लिख के या रिकॉर्ड करके अपने सवाल पहुंचा सकते हैं. इसके अलावा कोई और हेल्थ इश्यू पर जानकारी लेना चाहते हो तो भी आप यहीं पर पहुंच सकते हैं. अगर आप चाहेंगे आपकी आइडेंटिटी को हम कॉन्फिडेंशियल रखेंगे. Have a great day and stay tuned in with us on your favorite podcast on merasangeet.com.